I'm Dr. Mike LeNoir, and this is the Wellness Watch.
It's time for the Wellness Watch. Sponsored by the African American Wellness Project and blackdoctor.org. Hosted today by Dr. Michael LeNoir. Today's topic: environmental justice. Our special guest is Dr. Mark Mitchell. This is the first in a series of discussions on this topic. And now your host, Dr. Michael LeNoir.
Health and welcome to today's edition of Wellness Watch. Very important subject today on environmental justice. Our special guest is Dr. Mark Mitchell. Dr. Mitchell is a very distinguished academician whose passion for the environment has been very well recognized and respected. He has, I think, dragged many of us as African American physicians into the fray on providing access and information about environmental issues that impact the African American community. He is the co-chair of the Commission on Environmental Health of the National Medical Association, the Organization of Black Physicians. And Dr. Mitchell, welcome to the Wellness Watch.
Thank you, Dr. LeNoir.
All right, let's start out by getting some definitions. You know, it's sometimes not easy for us to appreciate what's going on in the environmental area. We know that President Biden's over in Europe talking about the environment, and there are issues that we can understand. But some things we don't really appreciate. What is environmental justice?
Right. So environmental justice refers to the fact that environmental hazards are disproportionately placed in low-income communities and in communities of color. And therefore, because we are exposed to more environmental hazards, we have more health problems in our community.
You know, tell us some of give me a couple of examples where environmental justice has a place. A story or two about some things that you've worked on now, or working on now, or worked on in the past.
Well, there are many things. There are many things, you know, and they vary from place to place around the country. There could be things like refineries in the South or wherever. It could be things like factories, chemical plants, but even things like roads and highways. In Connecticut, where I live, 2/3 of all of the air pollution is from traffic. 2/3, and our community, like many communities, is intersected by highways. And because of the air pollution from these highways, we have much higher rates of asthma. Other things I work on are things like trash incineration. In the northeastern part of the U.S., we burn more of our trash than other parts of the country. And those trash incinerators, the place that's most likely to have the trash incinerators is communities of color. And in fact, the greatest predictor of where environmental hazards are located is the percentage of people of color in those communities. And that's true throughout the country and throughout the world. Hazardous waste is dumped in communities, in countries that are primarily African countries or Latin American countries or low-income island nations. And so we see that environmental racism, which is the opposite of environmental justice, that environmental racism is something that we see throughout the world, throughout this country. There are more environmental hazards in the South, in the rural Black South, than there are in other parts of the country, as well as almost any community that I go to, where there's more than 100,000 people. There's an area of low-income whites or people of color that have higher rates of hazardous facilities, that have higher rates of landfills and other types of facilities that affect our health.
Do you think that most African Americans are aware of some of the environmental issues that impact them on a day-to-day basis?
No, and in fact, people aren't aware of all of the facilities that are located in their neighborhoods. I give something that we call environmental justice tours or toxic tours of our city. And I give it to some of the people who live here near these facilities, and they don't realize that there's so many facilities. So, for example, we have a trash incinerator which serves more than 50 towns. More than 50 towns bring their trash to Hartford to burn. We have recycling facilities where, again, 50 towns bring their recyclables here to be packaged and shipped elsewhere. We have medical waste facilities. We have a number of other types of major regional facilities. And so we have more than 600 trucks bringing waste and recycling into the city of Hartford every day. And so we're exposed to those fumes, the diesel fumes from that. And it's not unusual. People are exposed to a number of different exposures, and our health suffers because of it.
So are these facilities primarily focused, or at least existing close to African American communities, not just in Hartford, but across the country?
Yes. Again, that's the greatest predictor of where the facilities are located, is the percentage of African Americans and Latinos in most communities.
That is stunning to me. That is a disgraceful statistic, and we'll talk about maybe some ways in which people can get engaged in changing those dynamics. But as an allergist, I can tell you that if you look at the number of African Americans who are living in areas around the country that are close to freeways, are close to facilities like refineries, and the incidence of asthma in those communities, it's always, for many, many years, been a national disgrace. It's one of the expanders of health, of the issue of poor health equity for the African American community. One of the things that is interesting to me is that we, from my perspective, I'm not sure I really understand the climate that we live in, and what it looks like now, what it has looked like, and what it will look like if we don't intervene. Could you discuss that with us?
Right. Yeah. So climate change is happening. We're seeing it all around us. And African American physicians see the health effects of climate change in our patients more than other physicians do. The climate is changing, and obviously we're getting a lot more heat. We're getting droughts. We're getting wildfires in the West. We're getting more severe hurricanes in the Gulf and along the Atlantic coast, and even places that aren't near the coast. They're receiving more flooding, more rain. So when it rains, even if there's a drought, when it rains, it's more likely to have a downpour, a heavy downpour. And so we're seeing more flooding throughout the country, but particularly in the Midwest and northern Western states.
Wait a minute now, you're leaving out the real laboratory for need for environmental change when you don't talk about the Western United States, and particularly California. We've had some of the worst fires that I've ever seen. We had a drought here. We've had a drought here for 2 years, and all of a sudden, we get 12 inches of rain last week. And so we're the laboratory for climate change in this country as much as the East Coast.
Well, it's all over the country, and it's all over the world. The U.S. actually receives more issues with climate change than most of the rest of the world, but everybody's seeing it, everybody's affected, but African Americans are more affected than most people.
When you say the U.S. is, when people think about transgressors of climate change, they really don't think about the U.S. if they're living in the U.S. They think it's from China, Cambodia, Bangladesh, somewhere else. But
Right.
you say that we're one of the biggest transgressors. What evidence do you have for that?
Right. So historically, we have produced much more greenhouse gases, which lead to global warming, which cause all of these issues that we're seeing, that are causing the wildfires in the West, that are causing the floods in most of the country, that are causing the increased hurricanes in the East, that are causing more severe tornadoes. Even, I grew up in St. Louis, in the Midwest.
Yeah.
We are seeing more severe hail. We're seeing hail that damages rooftops, that damages cars, that cracks the cement, the sidewalks, and we never had that when I was growing up. So we're seeing those effects, and we know that it's from greenhouse gases like carbon dioxide, like natural gas, methane, like a number of other gases. And so we need to move to reduce those gases as soon as possible, because what we're putting in the air today will still be there in 30 years, in 50 years. It'll still be increasing the temperature in 30 and 50 years unless we make, but we can affect what happens after those 30 to 50 years.
So you're saying the damage has already been done.
Well, some of it has been done, but it can get worse if we don't do something now. We have to both mitigate, that is, to stop it from getting worse, as well as to adapt to the changes that are already happening. And our communities are most impacted. So we need to prepare our communities and to make sure that low-income people and people of color are centered in the plans to prepare communities and to evacuate communities when necessary because of severe weather.
You probably don't know this, but we share something. We lived in St. Louis.
Oh, really?
My father ran a YMCA on Kings Highway.
Oh, really?
We lived on Cavity Place.
Yeah. I knew that YMCA. We used to. My aunt used to be a swim and a lifeguard there.
Well, my dad was the first executive director of the one they put on Kings Highway.
Yeah.
So we lived in St. Louis for 11 years, 11 long years. The weather in St. Louis, even before climate change, was terrible.
Yeah, very hot, very humid.
It was hot, humid. It was cold and filled with snow.
Right.
I mean, we moved to New York, and we considered, that was his next job, was as the executive director of the Harlem YMCA. And so we moved to New York and when we packed up and left St. Louis, man, we left a lot of friends, but we left a lot of pretty bad weather that was already there.
Right. My mother actually came to St. Louis to work in the YMCA. Yes.
We'll talk about that offline. It's a small world among, we are 1 degree of separation always.
Yeah.
One of the things that bothers me is I don't see, and even for myself, many African Americans in terms of proportions involved in the environmental movement, be it climate change or environmental justice. Am I just not in the right places?
No, a lot of people don't recognize that the things that they're working on have to do with the environment. People don't realize that we're being exposed to many more hazards than others, and that the things that we're concerned about, the high asthma rates, the high allergy rates, the high cancer rates, we don't realize that that's due to exposures that are in our communities that aren't in most communities. So I think that we need to educate ourselves on the environmental hazards in our communities and what can be done to prevent them from winding up in communities like ours.
Well, I think many of us in the National Medical Association have fed off your passion for the environment because you kind of stuck with it when the rest of us were off and doing other things. And I think you brought us into the 21st century. Talk to us about the Commission on Environmental Justice of the National Medical Association. What is your objective? What are you doing?
Right. Okay. Yeah. And before I do that, I did want to also point out that environmental hazards are placed in low-income communities, but in communities of color of every income. So wealthy Blacks are exposed to more environmental hazards than wealthy or middle-income whites.
So you mean that 5,000 square foot house that you just bought to get out of the?
Yes, it's more likely to be put in a flood zone. You're more likely to have mold. You're more likely to be near a highway, etc.
The market, it never changes. I always tell people that if I get hurt in the city and I had to go to the emergency room, I'm gonna put on a suit and get a briefcase from somewhere. But that doesn't seem to change the outcome. So you're telling me that as we move out and we become upwardly mobile, we're still around these hazards. But tell us a little bit about the Commission on Environmental Justice, the National Medical Association, why it was formed, what it's done, what it's doing.
Right. So I was pleasantly surprised to find out that African American physicians are very interested in the environment once they realize how many diseases that we see in our patients are actually affected by the environment. And so that the National Medical Association we received a lot of support within the National Medical Association to weigh in on federal policies that disproportionately hurt communities of color and have an opportunity to promote policies on the federal level that also help communities of color. So some of the things that we do is to educate other physicians and other healthcare providers about the links between environmental hazards and the health of our communities. Things that people don't think about, like lupus and ADHD, and even things like depression, can be related to the environment. And things like hair care products for African American women. African American women use more of every type of hair care products than any other ethnic or gender group. Use more shampoo, conditioners, and as well as other treatments for hair care for hair. And there's a study that shows that there's a link between uterine fibroids and the number of scalp burns that a woman has had. And we believe that that's because of sometimes they use estrogens in a number of hair care products. And so those artificial estrogens can stimulate uterine fibroids. So what we try to do is to educate health professionals as well as the public on a number of these issues, and try to weigh in with Congress and with the administration to regulate these products and services to remove the toxics. You would think that people assume that government is protecting the health and that things are well regulated. If it's on the shelf, it must be safe. But that's absolutely not true, particularly of cosmetics. In the U.S., there are 8 or 9, maybe 9 substances that are banned from being used in cosmetics by the FDA. In Europe, there are 1,100 chemicals that are banned.
Say that again.
In the US, there are 9 chemicals that are banned from cosmetics. In Europe, there are 1,100.
Oh, wow.
So many many of the same cosmetics that are sold on the shelf in the US are banned in Europe, and they sell the same thing with a different formula, with a safer formula in Europe than they do in the US because we don't have the proper regulation. So that's one of the things that the Commission on Environmental Health does, is to try to say, we need at least as much protection as other countries. So, yeah.
Yeah, so one of the things that I really appreciate about your program is that you really are trying to develop some ambassadors in the Black medical community to talk about environmental justice and to act developing policy and being spokespersons for our community at the highest levels. Tell us about that program.
Right. So we do it through a number of things. Like I said, we do a lot of physician education, but we have also launched a climate and health equity fellowship program this year to train African American physicians on how climate affects health in communities of color and on the policies that need to be put in place to protect low-income communities and communities of color from the climate. We didn't talk about that climate change is on top of all of these other health problems that we're seeing. Climate change makes our pre-existing conditions worse. We're in our community, we're more likely to have diabetes, which also can be associated with the environment. We're more likely to have obesity, which also can be associated with the environment. We're more likely to have heart disease, which can be associated with the environment. So all of these things, which we obviously saw in the pandemic, that these things made it more likely that people in our community would get COVID-19. They also make it more likely that we will that with climate change we will have worse outcomes.
So let me ask you, how do those people who are interested in your health equity program, what would they do? I mean, how would they get engaged in that program, and
Right.
what would they be doing?
Right. So what we do is that right now this first class is only 6 fellows with the National Medical Association. So we are working through medical societies. We are working with the National Medical Association, the National Hispanic Medical Association, and then we also have opened it up to many other medical societies, to the physicians of color in other medical societies that are associated with the Medical Consortium on Climate and Health, which includes most medical societies.
So what kind of training do you give them?
So we provide them. Right now, we have we meet 2 half days a month on a Friday afternoon, the second Friday afternoon, and the fourth Thursday evening of the month, and we have national speakers that come and speak to them about environmental justice, about climate, about farm workers and the heat and exposure to chemicals, and then we talk about how climate affects all people, how it affects communities of color more, and we talked about the policies that both caused us to be in the situations that we are in now, and the policies that are needed to change to make us more resilient not only to climate change, but also to reduce our exposures to other environmental hazards.
Yeah, well, my question to you is when they get finished with this training, is this a career or is this just an addendum to what you do and what you can go back and do in your community? What exactly is the outcome for the physician that finishes this program?
Right. So they are much more likely to be engaged in policy. It can either be a career for a few people, but most will continue to use it throughout their careers and others. We're, for example, talking about how you can use it in your clinical practice. The American Academy of Pediatrics just came out with a recommendation on for patients on reducing on talking about climate change and reducing their energy use and increasing energy efficiency. And again, all across the political spectrum, people say that they like that they want to hear that from their doctors, that they are more likely to do something. Even the conservatives say that they're more likely to do something because their doctor pointed it out. I have known activists who have said that they became active when they found out that asthma is in their children may be related to environmental exposures, from the factory or from the or from traffic.
And I would imagine having a Black doctor engage in the discussion would move that needle even a bit more, because it is a little embarrassing that we have so few advocates, yet we have so much disease associated with the environment.
Right.
And I guess this program, I think, if it turns out, the number of doctors that have at least that as part of their profile, it can only be helpful. Let me ask you one question. Can you remember the reason and the time that you decided to get into the environmental discussion?
Yes.
About that.
Yeah. There were a couple of reasons. I was previously the director of the Hartford Health Department. And there were problems with odors from our landfill. We went there and they said, don't worry your pretty little head about it. And besides, you can't really, the health department doesn't really have authority to come here and tell us what to do because we're a quasi-governmental agency running this. And I said, well, it's absolutely wrong. Then there was also an incident where after I left the health department, where I was asked to do some camp physicals for some kids across the street from my office, and I found that a third of them had asthma. So I went back to my colleagues, my public health colleagues at the state, and said, I found that a number of children had asthma. Shouldn't we be doing something about it? You're the one that's in charge of investigating chronic disease outbreaks. We didn't know whether this is a chronic disease outbreak, but I'm very concerned about it. They said, well, it's not unusual for inner city kids to have asthma, so we don't need to really look at it. So I said, well, if that's going to be the case, then I think that I am going to dedicate my life to looking at environmentally related diseases. I also realized that when we're looking at health disparities, that the diseases that were increasing in frequency had more environmental links than those that were decreasing in frequency. And yet people weren't talking about protecting the public and protecting our communities from these conditions. And so that's when I decided that I would start an environmental justice organization and that I would work on environmental justice issues.
Well, Dr. Mark Mitchell, you may not know this, but you really are the hero to most of us in the National Medical Association. We hear about the environment, but it's really not at the top of our list of things. But you have brought it to the forefront and founding who's the other chair of the Commission on Environmental Health from the National Medical Association.
Yes, Dr. Doris Brown.
Yeah, so those are two very powerful voices in the struggle, and we really appreciate you, and I'm sure you received enough accolades that we don't have to give anymore. I'd like to talk directly to those of you who are looking at this program before we thank Dr. Mitchell. You know, you're involved in this. You got to get involved in the environmental issue. As you've seen, it affects us more than other people. And so consequently, having the kind of people that Dr. Mitchell is training, getting involved in your local community around the things that are around you is so critically important.
Thank you for watching the Wellness Watch. Sponsored by the African American Wellness Project and blackdoctor.org. Supported in part by a grant from the Chest Foundation. For more information, go to our website at www.aawellnessproject.org. That's aawellnessproject.org. Or listen to our podcast at Black Doctors Speak on any podcast channel. Wellness Watch is produced by Jojo Nash Marlowe Productions. Remember, health is your biggest asset, so protect it.